Welcome to the Tinnitus live stream. I am your host, Dr. Ben Thompson, audiologist, someone who is passionate about tinnitus management. I'm an audiologist from California area. That's where I've spent most of my professional career. And for those of you who are here live, please write in the chat right now where you're coming from. We'll be able to showcase that chat. So type it in wherever you're coming from of where do you live? Are you from California, New York, Texas, Florida, another state? Please let us know right in the chat. That's what we'll be looking for. We're going to cover some of the most frequently asked questions, and we're going to start with a question here that was pre-submitted. The question goes, my tinnitus recently got worse and is accompanied by popping in the ears when I swallow or yawn. Also, ear pressure. Is tinnitus related to Eustachian tube dysfunction curable? Well, problems with the Eustachian tube are curable, and in that sense, your issues with tinnitus can be improved. So when we're thinking Eustachian tube, let's take a step back and let's look at what's going on in terms of the Eustachian tube. Great to see you here live. Notion, Skaz, Pedro, hey everyone. The Eustachian tube is a small tube that connects from the mouth to behind the eardrum. And if there are some things like congestion, allergy, inflammation, pressure in the ear, middle ear fluid, certain kinds of other medical conditions, it can create some tinnitus. It can create changes to the auditory perception. We notice this very subtly, even if we are going up in altitude or down in altitude, we notice that the hearing system can change the perception. So changes to Eustachian tube dysfunction that can lead to tinnitus, is that curable? Eustachian tube problems are curable. Not every single Eustachian tube problem is cured, but there are medical treatments available, so please contact your ENT physician. Anyone who's watching this, either live or recorded, I want to say thank you for being here. This is something new that we're launching, which is going to happen on every Tuesday night, 7 p.m. Eastern, here on the East Coast time zone. And it's going to be available moving forward on every Tuesday evening. Why am I doing this? Because there's some of you who I know could benefit from going in the chat and asking questions to each other. So if you're here in the live stream chat, please write some questions. Now's your time. Write some questions here live in the chat and I'll be able to answer them. The purpose here is to create a sense of community and offer a new type of video, one that you can watch recorded, one that you can interact with. And whether you're coming from YouTube or Facebook, to connect with the other members of the community. I see Erica and L. Kent. Great to see you all. Very nice. Thank you for being here. All right, let's get to the next question. I don't know how I got tinnitus, but when I stopped drinking alcohol, suddenly I had a withdrawal and loud constant ringing in my ear. It was too loud. Can that be the reason for tinnitus? Thank you. Tinnitus is a rather tricky medical condition. Even things like starting or stopping the consumption of alcohol or going through some form of withdrawal from alcohol, other drugs, other pharmaceutical drugs even, tinnitus can result, the tinnitus can happen in effect. There can be a side effect of tinnitus after some of these medical conditions. We see this over and over, whether that's with pharmaceutical drugs, certain types of health conditions, anxiety, stress, lifestyle changes, going through interpersonal relationship conflicts, early retirement or financial stress, stress at work. Any of those situations can trigger tinnitus. And some of the mechanisms are physiological, whereas some other mechanisms are more psychological. Either way, the relationship between the ear, the auditory brain, and the limbic system, the psychological center of the brain, that's where we want to spend most of our time understanding. When we understand that system well, then no matter what caused a spike in tinnitus, we can manage it. In a vast majority of cases, tinnitus can get better. We have some great questions coming in. We have Anthony here sharing that they have an upcoming consultation with one of our providers. That's amazing. Thank you, Anthony. We have a question here from L. Kent. Neck angle lying down. Also, is this awakening response I've read? Is this real? Well, the neck angle and the upper neck conditions can create tinnitus or make worse tinnitus. I recently had an interview with an ENT physician on my YouTube channel, Michael Golenhofen, ENT doctor in Germany. They were describing their research into upper neck conditions and how that may affect tinnitus. I learned a lot from that podcast, and it's been one of the most popular videos on my YouTube channel. The major takeaway here is that upper neck differences, abnormalities, even something that you might not notice too much day to day on your own, can affect the networks that connect between the neck, the temporal bone, and the areas around the ear, and that can lead to tinnitus. So another topic here that's commonly asked is TMJ. Well, the temporal bone and the mandible jaw, they meet here in what's called the temporomandibular joint, or the TMJ, and there can be disorders there. Going to a dentist, being evaluated for that region of the head, and potentially treated with something like a mouth guard to be worn in the evenings, someone can experience improvements to tinnitus. Maybe it's a 10% improvement, maybe it's a lot more. Any little improvement we can get from the holistic management of tinnitus is welcome. That's what we focus on here. All right, we have a live question from Interest. Is sound therapy only helpful in habituating, or does it also help lower the volume of your tinnitus over time? When I think of managing tinnitus with sound therapy, I think of going to the doctor for a broken wrist. I played a lot of basketball growing up, and I've actually broken both individual wrists. Well, when I went to the doctor, they said, your wrist is broken, something is abnormal. It's going to take 6 to 8 weeks of time for the wrist to heal. And during that process, we advise you wear a cast, either a hard cast or a soft cast. By the end of that healing process, you won't be feeling 100%, but you'll be good enough and you'll be back to essentially normal. We have some physical therapy exercises after that. But what does that mean to me? Well, there's a time window of a broken wrist in the same way that there's a time window of retraining or managing tinnitus when it's new into our lives, like a sudden case of louder tinnitus. By the end of it, I don't need to use a cast for my wrist. By the end of sound therapy, I don't necessarily need to use the sound therapy to manage the tinnitus anymore. If someone has reached that habituated state, then the sound therapy can be used as needed. But until then, and that can take between 1 and 2 years sometimes, until then, we recommend using sound enrichment, using sound as a therapeutic tool. Hope that makes sense. Great question. Thank you for that. Okay, we're going to go to one of the questions that was submitted earlier. And someone says, I'm 4 weeks into dealing with tinnitus. Why are some days a lot worse than others? This is a great question. This is a question that confuses a lot of professionals and confuses a lot of patients. Let me try to bring some clarity. There's different systems at play that can affect tinnitus. We have the psychological systems, which every day, whether we're conscious aware of it or not, or it's subconsciously happening, are affected by things like future worrying, stress, anxiety, concerns, fear. And then we have the physical health of the body, the autonomic nervous system, the central nervous system, which is affected by things like stress, sleep, exercise, nutrition, and if we're physically ill or if we're feeling healthy. We also have the auditory system with things like sound therapy, sudden changes to hearing, noise-induced hearing loss, being around too loud of sounds, or if we don't have any sound therapy, then being in silent places can make tinnitus worse. That said, we have somewhat of a limited understanding for each individual of why tinnitus can have some loud days and some very soft days. One thing that's important to discuss is that tinnitus is a mysterious and challenging medical condition in the sense that for some aspects of tinnitus, we just have to accept that there is variability and that I won't necessarily ever know why I have some bad days and some good days, because psychologically accepting it from what I've seen helping patients helps move the process along a lot faster than trying to solve and take a tinnitus diary, which I don't recommend, and go through all of these hyper obsessive tracking components to try to understand the subtle components, when in reality that might be making it worse than it has to be. So you have to be sensitive and, of course, reach out for help if that's helpful to you. All right, great here. So great to see everyone in the chat who is here live. There's over 30 people who are here live. So ask your questions, connect with each other. Remember, we're here to be positive. Tinnitus can be very hard to manage. And I encourage you to do your best in the live chat to be as positive as possible. We'll take one of the live questions here. All right. So Notion asks, I have friends that had tinnitus for 6 months, others for 3 months, and others for 1 year. One day the tinnitus just stops. Is that just luck? Habituation. So first of all, let's define habituation. Habituation of tinnitus means that at some point, the brain gets to the stage where the brain can automatically tune out or reduce the perception or the awareness of a sensation, in our case, of the sound of tinnitus. Now, this happens all the time if we think about our other senses. We have the habituation of smell. If you're used to the smell of your house, then your brain won't tell you that the smell is a certain way. It is what it is. We have habituation of touch, like the clothes on my skin, like wearing a watch, like the socks on my feet. And all of that we are now feeling because I'm speaking about it. But before then, we weren't touching it, we weren't feeling it. Our brain had tuned it out. Well, the same thing can happen for sound. Common sounds that we can habituate to are the sounds of the refrigerator, the sounds of the fan on my computer, the sounds of the natural world around us, and the sound of tinnitus. When the brain can react to tinnitus in a neutral way over time, that helps reduce the perception. During that habituation process, the sound usually gets softer too. Now, there's some debate of, is the sound actually getting softer, or is the brain and the limbic system tuning it out and filtering it to the degree where even if it's the same neuronal activity, doesn't necessarily matter because you're not perceiving it as much. There's some debate about that. It's still a little hard to understand. To get right at your question, is that just luck? The habituation process is natural, right? Of course, my life's work is dedicated to helping you facilitate that habituation process. It's natural. Is it lucky? I wouldn't say that luck is the main driving factor. I would say that the brain is naturally designed to do this, and a vast majority of new sudden tinnitus cases habituate to it. What you need to focus on is what can you do to make that process happen as quickly, as easily as possible. Some people habituate in 3 months, other people in 6 months, other people in a year and a half. The timeline it takes, of course, we want it to be as short as possible. We're not so focused on how long it takes as much as what is the direction we're headed. That's all you can control. That's all that I coach people to help with is, are we headed in the right direction? Are you doing the right things? Do you have the right mindset? Do you have the right cognitive, psychological tools to handle this? Because then, yes, we have to let nature take its course. Thank you for that question. Again, want to welcome anyone who's here live and encourage you to ask questions and interact with the group. I'm planning to be here next week at the same time, 7 p.m. Eastern. So if you're coming here for the first time, or if you're just curious, please do come back. Looking forward to that. Okay, we have a question. Do hearing aids ever have a negative effect on tinnitus? Very rarely, yes. And here's why. I did an interview with a gentleman who is a hearing professional, a hearing aid dispenser, and they had what is considered reactive tinnitus. That means no matter how much sound therapy they had around them, the tinnitus always jumped to being louder than it. So I know that's not probably what you're experiencing because it's very rare. In those cases, it wouldn't make sense to consistently use sound therapy because every time that it was used, the tinnitus just got louder. So in that rare case, it was it was better psychologically. It was better for that person to be in quiet instead of to have very loud sound therapy to try to mix with the tinnitus. Otherwise, hearing aids don't have a negative impact on tinnitus. For a vast majority of cases, they have a positive impact. Let me explain. Hearing aids today are not what you might think of as a hearing aid. Small, discreet, high tech, connected to Bluetooth, take hands free phone calls, stream sound therapy to your ears, some very positive things. Hearing aids are also a tinnitus aid. Think about that. If you're considering, is this hearing aid going to help with my tinnitus? Is tinnitus the primary reason I'm considering a hearing aid? Then I would actually call it a tinnitus aid because that's the primary help you're going to get. We see this from the amplification settings of the hearing aid itself, plus the tinnitus sound therapy. So I'm often through telehealth encouraging people to use certain kinds of hearing aids that can provide the sound therapy according to the tinnitus retraining therapy protocols. And therefore, I've seen that hearing aids are often a big help and not a negative impact. So if you're interested in hearing aids, I advise you to find the right professional who can consult you on what you need. And then whether you get that from online or in person with an audiologist in a clinic, try that because each state usually has a pretty generous trial period or return period. So I advise you to consider that. We have a question from Jacopo, who says they're from Seattle, Washington. What's going on? Jacopo says, I noticed that hyperacusis with pain tends to get better over time. It's been 6 months. As long as they're not exposed to too many loud sounds. They're afraid that TRT might worsen things. I'm assuming I'm assuming that when you say TRT, you're referring to the sound therapy part of it, because it's worth mentioning that TRT involves high quality education on tinnitus, the sound therapy component, and professional counseling from someone who's trained in TRT counseling. There's some confusion where people think that sound therapy itself is TRT, or people think that hearing aids for sound therapy is TRT. I believe that you're getting a good education on tinnitus if you're watching a lot of my YouTube videos. I don't know if you have professional counseling about the TRT retraining. And if you're following the principle of sound enrichment, then that means you are definitely following the sound therapy aspect of TRT. All right. To answer your question here, hyperacusis does get better over time. There's two types of hyperacusis. One is that it's reactive to loud sounds, and that causes a sensitivity similar to if I have a migraine and there's a bright light, then I'll be sensitive to that light. It's not that my eyes are, it's not that the structure of my eyes are behaving abnormally. It's actually that the neurological brain reaction to the light is too much and it's sensitive. Well, in a similar domain, hyperacusis is sensitivity to sound. So the main type of hyperacusis is sounds are too loud. I start to move away. I start to feel that I can't take it and that it's irritating and that it's too loud. And what previously was loud but okay is now too loud, uncomfortable, too much. The less common type of hyperacusis is pain hyperacusis, where it feels as if there's ear pain or that I have an ear infection or there's something inside the ear canal or in the ear that's causing some sharp pain. I'm more familiar with the loudness hyperacusis. That's more in the audiologist domain to help with. The pain hyperacusis, that's typically the ENT, the ear, nose, throat doctor. That's in their domain to try to manage and treat and potentially solve that problem, find a solution for that. TRT won't worsen things, right? If you're someone who truly has reactive tinnitus, where every time you're hearing sound therapy, it's painful, then it wouldn't make logical sense to make that part of your daily routine. For the majority of patients who have hyperacusis, the sound enrichment aspect is highly recommended. Also, for hyperacusis, do not wear earplugs 24/7 or restrict your hearing, making you hear less and less of the environment, because that can have inadvertently negative effects. Thank you for this question. Let's check out some of the other pre-submitted questions on our side. And again, for those who are here live, make sure to get in the comments, get to know each other. Remember, we're here to be positive. This is a positive community. The internet for tinnitus can be a dark place. And if you agree with that, let me know. But what I've tried to bring is some optimism and positivity to this community. While I'm speaking here, I'll let you know that every Tuesday night, planning to do this live stream for tinnitus. Every Thursday night, planning to do a live stream for hearing loss and hearing aid technology. That's somewhere I'm taking my content, which is partly for tinnitus, of course, maintaining my passion for tinnitus and all the videos that are coming with it, and also using YouTube to create more videos for hearing aids, hearing loss, hearing technology. Excited for that. Next question we have here on the Google form that was submitted in the description of this video. You can submit your own question through the Google form. This is a great question. I'm happy someone asked this. What can be done to minimize tinnitus feelings such as fluttering or a feeling like an insect is crawling in your ears as opposed to masking sounds? There's something called tensor tympani syndrome, and most likely this is what you're describing. When you describe fluttering of the ears, there's two potential considerations. One is Eustachian tube dysfunction, that little tube that connects from the mouth to behind the eardrum. If I pop my ears, that's sending air through the Eustachian tube behind the eardrum. A little fact for you guys is that I lived in Hawaii for a year and I took a free diving course where we were trained how to equalize our ears and equalize our system and going down up to 66 feet or 20 meters. And that was one of the most incredible things I've ever done. If anyone's interested in that, would highly recommend it. And we were experts at equalizing our ears because we needed to do it every meter or two, going down, down, down. It was really fun. So the one possible consideration for that fluttering feeling is Eustachian tube dysfunction, or what's called a patulous Eustachian tube. Another consideration for that fluttering sound, feeling like there's insect or something thumping or fluttering in the ear, typically just one ear at a time, sometimes two, that's considered suspect for tensor tympani conditions, or what's also called tensor tympani syndrome. Say that 5 times fast. Tensor tympani syndrome is this little muscle that connects behind the eardrum, and it's there to protect us because naturally, if there's a very loud sound, then the tensor tympani will constrict, and that will give our hearing a little extra security or safety from very loud sounds. So evolutionarily speaking, this was a protective mechanism, so we think. What can happen is that my leg can have muscle spasms, my hands can have muscle spasms, and that little muscle behind the ear can also have a muscle spasm of sort, where that tensor tympani is fluttering and it's moving at a high frequency. So it sounds like an insect. I can't do it so well with my mouth. I'll try again. Something like that. A fluttering sound like an insect or a thumping. And what can you do for that? Well, usually what's happening, in my understanding, is that it's an effect of a heightened activated central nervous system. So all of the recommendations from the holistic side of this, calming the mind, calming the body, focusing on your sleep, focusing on your pre-sleep routine, considering meditation, walking more, eating better, exercising. I love all of those things. They make me feel great. And when I feel great doing them, then the body and the central nervous system can be at a more peaceful, calm state. When that happens, what can be a result is that thumping, that tensor tympani condition gets better. The muscle's not spasming or acting out of balance anymore. It gets better. And those episodes where you're feeling that happen less. And when they happen, it's not as bad. Thanks for asking that question. It's an excellent question. It's not such a common condition, but in our field of tinnitus, hyperacusis, we must know about that. So some doctors might not have diagnosed that. I advise you to follow up with an ENT doctor if you're looking for a more specific diagnosis on that. And of course, again, thanks for asking. All right, how you guys doing in the comments here? See Anthony, Melissa from Massachusetts. Hey, Melissa, how's it going? Have Addie, Frank, Jim, Prep to Survive, who's a frequent commenter on the videos. Nice to see you here. Edka, Fog, Jim, Justin. Awesome. So let me run through some of these questions here. And Frank says that we should do these more often. I'm with you, Frank. As long as you show up, let's do it. Okay, so I'm not going to answer all these questions. Some of them are either too complex to try to answer without knowing your personal history, or they're not best served for this live stream setting. So if I skip over your question, please forgive me. I hope you understand. All right. So we have a lot of excellent questions here. Let me try to pull one up. Live question coming in from Notion. I'm dealing with tinnitus over 2 months. This Thursday, I have my second appointment with the ENT. What should be my prime questions to ask this doctor? If I'm giving general recommendations of what to ask your ENT, it's what kind of hearing loss do I have, if any? Is there anything abnormal in my medical workup? Is there anything you see that might give reason to have further testing, like an MRI or other kinds of referrals to other doctors? Do I have any symptoms that might suggest TMJ concern, like grinding teeth, tension around the ear or the temporal bone, tension in the jaw, things like that? Do I have any suspicion that my neck has something to do with it, whether it's my posture or the neck muscles? And if my sleep is not doing so well, I would ask the doctor, what are my options for managing sleep? Specifically, they have pharmaceutical resources available, whereas you trying to figure out your sleep are going to focus on more holistic cognitive behavioral approaches to sleep and insomnia, whereas a doctor is the right person to ask, should I be considering anything else to help with sleep like medications? Great question, and thanks for asking. All right, let's see what else got here. Love all the comments going on. You guys are doing great. It's amazing. Let's see here. Discotheque, thanks for the love. Many times your words gave me comfort in this madness. I know this is a tough condition, tinnitus. The comfort is soothing, the comfort is important, right? It's amazing that we have the internet where we can do this, where I can put out videos that you guys can benefit from. All right, let's see here. Ben, will there be a 24-hour international live stream support network for tinnitus sufferers? I don't know if there will be. I need to sleep, so I won't be leading that. But it's a good idea. You might want to ask some other professionals if they would want to partake. Let's see here. We have a nice question coming in from Mad Duck, if that is your real name. The question is, does taking anxiety medication keep you from habituation? No, not necessarily. In fact, anti-anxiety medication can very much help someone get through the urgent care phase of panic, insomnia, high anxiety. That said, you have to advocate for yourself. If you don't want to take anti-anxiety medication long term, then you need to advocate and explain that to your doctor who's prescribing them. Try not to be too afraid that any one thing is going to make your tinnitus worse for a short period of time. It's not typically what we see, whether that's caffeine, salt, medication, even certain kinds of noises. It's pretty rare that any of those things can really make tinnitus worse. And they definitely won't make tinnitus permanently worse because they're not going to change the structure of hearing or the permanent structures that are at play. Some anti-anxiety medication should be taken with some caution, and that's really designed to be used for a short-term basis, but not forever. For example, benzodiazepines are a drug family that we advise you have a conversation with your doctor of, I want to consider what is the long-term path with this drug and how can it help me manage tinnitus. There is not a drug necessarily that's prescribed directly for tinnitus. Usually a drug is prescribed of this can help tinnitus and all the side effects that are coming with it, whether that's insomnia, sleep, anxiety, stress, panic, things like that. Thank you for your question. Skylar from Washington, how's it going? Nice. Next question is coming from Warren. Warren asks, am I hurting myself wearing my hearing aids constantly? I've been sleeping 6 to 8 hours with the hearing aids on. Any thoughts? You are not hurting your tinnitus. You are not making your tinnitus worse by wearing hearing aids, nor by using sound therapy. Sound therapy is safe. There is not a dependency to sound therapy. Sound therapy is used as a therapeutic tool. That's why it's called sound therapy, not just sound or sound relief. There's no risk of damaging your hearing from listening to low-level sound therapy for all hours of the day. In fact, this has been studied. As long as sounds are below around 85, 80 decibels, then you can listen to them for 40 hours a week. That was designed for workers who are around loud sounds, who we need to protect their hearing and making sure there's no permanent changes to the hearing organ, the cochlea. For tinnitus, it's a neurological reaction, and sound therapy is useful. So have no shame. Don't feel like you're giving in to the tinnitus or that the tinnitus is beating you and you have to use sound therapy. Don't believe any of those negative thoughts that come up. I am a big proponent of sound therapy. I've seen no research to suggest no broad research, no serious peer-reviewed research to suggest that sound therapy can be bad for someone who's managing tinnitus. Therefore, you can use it. You can follow the principle of sound enrichment and use it as needed. Use it as you can find time and space and what makes sense for you, whether that's hearing aids, bone conduction headphones, AirPods in certain situations, headphones in certain situations, a sound therapy machine, coming from an app on your phone, coming from speakers in your indoor office, in your home. All hands on deck, do what we can to use sound therapy, and I hope that works out for you. Thanks for the question. Okay, I'm reading through some of the questions here. Quick question from Lorenzo. How can somatic tinnitus be treated? Neck, jaw, head pain. TMJ. TMJ treatment is usually done by a dentist. And what they do is they put a mouthpiece or a mouth guard in your mouth. They don't put it in your mouth, but they take an impression of your mouth and they usually fit a mouth guard that you wear either either for parts of the day or just the evenings while you sleep. There's some other kinds of treatments that can be used for jaw, TMJ conditions. I'm not a dentist. I don't specialize in TMJ. And it's something that I try to identify as a potential cause and then refer to a dentist who can do an assessment for craniomandibular dysfunction. So, cranium, head, mandible, jaw, dysfunction, something's not working. So, this area between the head and the jaw, the joint, the TMJ, temporomandibular joint, that TMJ can be working incorrectly. And if so, that treatment could potentially help your tinnitus. I've seen anecdotal reports on comments and people explaining, yeah, the TMJ mouth guard really helped. So it's not something to overlook and say, oh, that's a rare thing. It's something that you should have evaluated, just like you get a hearing test. If you have jaw symptoms, we want you to get evaluated by a dentist for those kinds of conditions too. Other than that, you'll have to ask a dental professional for the different treatment options, potentially going to a TMJ specialist. Thank you for your question. All right, we're going to keep going. We're going to keep trucking through. I have a question here on the side of the pre-submitted questions. If an audio, okay, ready? If an audiogram, what is the question? If my audiogram. The question is, if my audiogram shows no hearing loss, but there could be hearing loss. Okay, I need to redo that because that question was not written correctly. If an audiogram shows no hearing loss, could there still be hearing loss? Why isn't a hearing aid recommended or prescribed in my treatment if my audiogram showed that my hearing was in the normal range? Excellent question. Something I'm passionate about is educating about the different kinds of tests of the hearing system. So the first major kind of test is an audiogram. That's the beep sounds from 250 to 8,000 hertz, low pitch to high pitch, bass, mids, treble. And you get to test your hearing and we determine what degree of hearing threshold do you have. Is it all in the normal range? Is it partly abnormal? And if so, we'd have certain treatments for that. Another main test is called the tympanometry, which measures the eardrum movement. For most people with tinnitus, that's normal, in the normal range. The final test, which is not often done as part of a typical workup for a hearing test, is something called otoacoustic emissions, or the OAE test. That's measuring the small little cells, the hair cells they're called, inside of the cochlea, the hearing organ. Those are referred to as stereocilia, or inner hair cells, or outer hair cells. And the OAE test is specifically testing the outer hair cell function. Someone can have a hearing test in the normal range, but their OAEs, the stereocilia, are abnormal. That's actually the first expression of changes to the cochlea before it shows up on the audiogram. So for sometimes this is called hidden hearing loss. Other times this is the exact biometric marker, the exact physiological marker to explain, aha, there is a change in the hearing system. And for most older adults, those OAE tests are not completely normal. For most people who have had some loud noise exposure or who have definitely developed tinnitus, those OAE tests are a vast majority of times abnormal. And that explains why tinnitus can be there in the first place. So if there's absent hearing of the cells of the cochlea, then it creates this chain of event response that can lead to a phantom sound in the auditory brain. Damage to the cells in the cochlea or changes over time to the cells in the cochlea, leading to a phantom sound response in the auditory brain. So you think of phantom limb, you think of I lost my arm got cut off, and I still feel my hand. That happens. Someone is amputated their arm and they can still feel their hand. Well, their hand's not actually there, but the brain makes up that sensation or that perception. And the cells of the hand, where the hand used to go to, they're firing this phantom limb. Well, for hearing, the same mechanism can provide a phantom sound response. To answer your specific question, should you be using a hearing aid if your hearing is in the normal range? You're certainly welcome to use sound generators, ear level sound generators, or hearing aids programmed just for tinnitus with little to no amplification function. You're certainly welcome to do that. And as a tinnitus specialist, I would often explain that as an option, oftentimes recommend it for someone who's trying to follow tinnitus retraining therapy in full. However, it's not completely necessary. So I imagine that if this is you who's asking this question, that you perhaps have this situation yourself and your local audiologist may have said, no, I don't recommend hearing aids. Whereas from what I've seen from research I'm following, from trainings I've completed, from experience, that's an option that should be kept on the table. And for someone who wants to follow TRT as best as they can, then having sound enrichment is an important part of that. It doesn't necessarily need to come from devices on your ears, but oftentimes that's the most sustainable, practical way to use that for a matter of months to sometimes over a year. Thanks for your question. All right, we have some great comments here in the chats. I'm loving all of the community bonding, we'll call it. Most of you here are coming from YouTube, so that's great. All right. KC asked me a question. Yeah, KC, that sounds good. You can contact us. Thank you. All right, we have Lorenzo from the Dominicana República. Thank you, from the Dominican Republic. Very cool. Love YouTube for that. Let's see here. Mad Duck asks, last month, one day I woke up and my tinnitus was gone for 24 hours, but it slowly came back. What do you think caused it to go away for a day? I really don't know. It could have been something to the central nervous system. It could have been something to the psychology system. It could have been something else. Sometimes tinnitus does weird things, and it can be frustrating if you don't know exactly why it happened. My advice here is speak to a professional who knows it well, because they can understand your individual history and they can give you feedback of, oh, that's par for the course, nothing to worry about. Yeah, it's not comfortable and sorry that happened, but I don't have an answer for that. It's also not a red flag. That is reassuring. That's what you probably want to hear. Without knowing your full history, I'm not sure I can say that. If you don't have that sort of affirmation, then it can create this kind of worrying, this lingering mental stress of trying to figure this out on your own and wondering, is this significant? Is this a red flag for something? By the way, I don't think that's not a red flag for anything, but you get what I'm saying, is that it can create this mental stress where you're trying to solve this, trying to figure this out, and it's a little overwhelming. So anyways, I'm not too worried about that. Speak to someone individually if you wanted more questions. All right. looking through the questions here. How do I feel about cochlear implants for single-sided deafness? Love this question. Totally not about tinnitus, and I love it. As an audiologist, we do work with cochlear implants and we do work with single-sided deafness. Now I will plug that on Thursday, we have me and another doctor on our team who will be doing the same live stream on Thursday at the same time, 7 p.m. Eastern. We'll be focusing on hearing loss, hearing aid technology, even things like single-sided deafness, cochlear implants, hearing aid technology, different apps, AirPods, can they be used as hearing aids? Some awesome questions. This is just a great time to be an audiologist. I love it. So single-sided deafness, that means someone cannot hear on one ear, right? They lost their hearing or they were born without hearing. That's an important distinction. Cochlear implant, it's something for someone who has severe to profound hearing loss. So if I'm deaf on one ear, then I have severe to profound hearing loss. The important question is, can the cochlear implant connect with the neurons on the auditory nerve on that side? The best predicting factor of that is how long have you been deaf on that side? If you've been deaf on that side for months, then you have the highest chance of the cochlear implant connecting with those nerve cells and the hearing comes in well. Of course, cochlear implants take time. That's a whole process. And they could improve tinnitus. So that's cool. The other side of this is if you've had single-sided deafness for 10 years or more, it's less likely that the cochlear implant will lead to improved speech recognition. It may help with tinnitus. That's a little hard to predict. And of course, if you're asking that question, I hope that you have a cochlear implant audiologist in your local city or local area that you can ask those questions to. They're good questions. I will say that I worked at the Cochlear Implant Center at UCSF Hospital in San Francisco, California. I was completing my audiology residency there, and it was an amazing experience working at the Cochlear Implant Center. My mentors were fantastic, some of the best audiologists, and such a specialized skill. It's quite amazing, this prosthetic device that can bring back hearing function from someone who is completely deaf to the point where a hearing aid wouldn't even work. Amazing stuff, something to look into if you have severe to profound hearing loss or someone you know. Big shout out to all of the live viewers here. I advise you all, hope, and I would love to see you next week at 7 p.m. Eastern on Tuesday, as well as 7 p.m. Eastern on Thursday. And I'm your host, Dr. Ben Thompson. Of course, if you're subscribed to my YouTube channel, thanks for being part of this community. Laura writes so many interesting questions. Thanks, Laura. Nice to see you here. All right. Okay, Laura asks, hearing aids and sound therapy aids, are they different or are they not? Sound therapy aids are often called ear level sound generators, and hearing aids are hearing aids. You can get hearing aids that are programmed just for tinnitus, meaning that there's no amplification of the sound around you. You cannot get ear level sound generators that are programmed for hearing loss. Nowadays, I would say it's probably 80% people who have hearing in the normal range who would not benefit from hearing aids are recommended hearing aids, but they're only programmed for tinnitus, meaning they just have the sound therapy, not necessarily the amplification. Hope that helps. All right, this will be my last quick question here. This question is about neuromodulation for tinnitus. This question is coming from A.K. Asking any opinion regarding neuromodulation as a tinnitus treatment. I can say that neuromodulation typically means I have things in my ears that are playing auditory sounds, and the auditory brain can potentially modulate or change based on the input. I saw that this was experimental and being researched most often between 2010 and 2015, possibly earlier too. I got into the audiology profession before around 2015. So I was only exposed to it from that point. Neuromodulation is not commonly recommended. I'm thinking historically things like dysynchra, which uses sound to reduce the neuronal activity around the tinnitus. That had mixed results. It was somewhat experimental, but ended up not continuing on. The more recent form of neuro treatments for tinnitus is bimodal stimulation, meaning two separate nerve pathways stimulating around the same time. And that has some promise. Things like Neuromod's research, Susan Shore's research, and potentially Neosensory's research as that's developing. That's my opinion. Neuromodulation, not something that I recommend to patients. And there may be some other types of fringe neuromodulation modalities that I'm not too familiar with. And quite frankly, I don't think you need those to get better. Consider that as something you try after you've gone through the fundamentals, the foundations of tinnitus. And from there, you should be okay. All right, guys. Thank you so much to the community here for showing up. Again, next week on Tuesday, same time, 7 p.m. Eastern. Started a little bit late today. Sorry about that. Had some technical things to figure out. And then this Thursday, we're talking all about hearing aids, hearing technology, some new developments, tools to manage hearing loss. Do you even need a hearing aid? Those are the things we're going to cover. And I'm going to introduce a new colleague, a new member of our provider team at Pure Tinnitus. That's exciting. So try to be there on Thursday at 7 p.m. Eastern. And my dream is that we have a developing live stream community here. And this is not only YouTube necessarily, because we have Facebook as well. So hoping that we can have fun. This can be a good time to connect and I can answer some good questions. Well, good night, everyone. And thank you so much. Ciao.